chondroitin, as a building block, then is attached to proteins that creates proteoglycans. And these proteoglycans are these chains that, when assembled by your body, end up making cartilage. And this allows for that compression and cushioning component that is so important for cartilage, right? So cartilage is very different than bone. Bone is harder, it is more brittle, and it is less flexible, right? So cartilage is quite important when on the joint spaces of bones, where two bones will interact. You have a cartilaginous space that allows for cushioning, and as well as reduced friction. Okay, hyaluronic acid is another chief component, and this is part. Hyaluronic acid helps create this extracellular matrix, specifically to help other cells and organize within this extracellular matrix. And what I mean by that is, if you can imagine, some cells are quite dense. For example, bone cells tend to be quite dense, and it makes the bone hard. Other parts of your body have an extracellular matrix that allows for less density, and you want this, for example, in your synovial fluid, in your joint spaces. And so hyaluronic acid it specifically allows for this extracellular space that's not very dense, that allows for smooth movements and decreased friction within your synovial fluid. That's another building block that we talk about. Methylsulfonylmethane. Methylsulfonylmethane, also known as MSM, because no one wants to say methylsulfonylmethane too many times, otherwise they may have a problem. So this is another. It's an anchor or a building block for cartilage. We've seen studies in which the use of MSM for 12 weeks has been shown to decrease joint pain and increase mobility. And so it works in conjunction with a lot of these other building blocks. Another one that I want to talk about is collagen, specifically collagen type 2. There are many types of collagen: collagen type 1, collagen type 2, 3, 4. But collagen type 2 is found most frequently in joints, in joint-related cartilage. Articular cartilage, and articular cartilage is the cartilage found in joints. Okay. This type of cartilage is comprised 85 to 90% of collagen type 2. We see this with disease states in which a genetic problem with gene expression leads the body to not produce collagen type 2. And in those patients, they have severe growth abnormalities. Specifically, they have spondyloepiphyseal dysplasia, which means their growth plates don't propagate new bone, and it's essentially a type of dwarfism. They also have what's called primary osteoarthritis, meaning they have osteoarthritis, from a very early age, because they can't build that articular cartilage that's so important for cushioning your movements, for allowing smooth bone-to-bone sliding that otherwise, if not there, causes inflammation, swelling, pain, and rigidity.